Dementia end-of-life symptoms. Many people don't realize or understand that dementia is considered a life-limiting illness, meaning that it is terminal. People will eventually die from the disease causing the dementia, but the time frame and the symptoms can vary person to person and depending on the type of dementia that the person has. Hi, it's Katie Duncan here with Death Care Coach. I'm a nurse practitioner and an end-of-life coach, and I'm here to help you prepare for the end-of-life journey. In this video, let's briefly break down dementia and the different types of dementia. Then, let's talk about some of the most common signs of approaching death for a person with dementia. We'll also briefly talk about how hospice can support a person with end-stage dementia, as well as their family or their caregiver. And lastly, let's talk about general life expectancy for dementia. So first, dementia. Dementia is not a disease itself. It is really an umbrella term used to describe a group of different symptoms associated with ongoing decline in the brain's ability to function. And the symptoms are severe enough to eventually interfere with a person's daily life and their ability to function in daily life. Some of the most common types of dementia include vascular dementia, Alzheimer's disease, Lewy body dementia, and frontotemporal dementia. There are also other types of diseases that do cause dementia as well. These include things like Parkinson's disease, Huntington's disease, HIV, Creutzfeldt-Jakob disease, Corticobasal syndrome, and others as well. They all fall under this umbrella term of dementia and affect the brain in different ways. Dementia is progressive, meaning that the symptoms get worse over time as the brain continues to break down. The most common symptoms of dementia include memory loss, confusion, needing help with daily activities and tasks, problems with language and understanding, and decision-making and changes in behavior. Our neurological system, or our brain system, controls everything that we do and everything that we are. Without our brain's neurological system, we wouldn't be alive. It is how we survive as humans. It's what allows us to move and to think and to feel and to experience emotions, to speak and to understand language. It also controls our organ functions and our autonomic or automatic system. It tells our heart to beat and our lungs to breathe and our brains to sleep, and it keeps our body's temperature in check. In the final stages or the end stages of dementia, the breakdown of the neurological system is so severe that it affects the most vital aspects of living, and it can even cause the heart and lungs to stop functioning. As the brain becomes more and more affected, and as dementia continues to progress, this puts the person at a much higher risk for complications as well, especially things like infections. For example, the person with dementia will eventually lose the ability to swallow adequately. This puts them at a very high risk for developing aspiration pneumonia, malnutrition, and dehydration. And because a person with dementia becomes immunocompromised, their immune system doesn't function normally, infections can be serious. And pneumonia is one of the most common causes of death in a person with dementia. Similarly, a person with dementia will eventually lose the ability to talk and to walk and to feed themselves and to control their bodily functions. So, for example, their ability to hold their urine and their bowel movements. And because of their inability to walk and their poor judgment, they are at a high risk for things like falls and injuring themselves. And this could be fatal, or it could lead to further complications. When the person stops walking and they're in bed or in a chair more often, there will also be more pressure on parts of the body, and this can lead to things like pressure ulcers, infections, or even blood clots. when they lose control of their bladder and their bowels. This also puts them at a high risk for developing urinary tract infections. And this is also another really common cause of death in a person with dementia. When I think about the progression of dementia, I think about a person basically walking down a flight of steps. So, what I mean is that they can be kind of the same for a while on this plateau step, and then something happens like a fall or a change in the environment or a hospitalization or an infection, and suddenly they step down the staircase and they seem to be worse. Now, after that acute event, they might bounce back a little bit, but they won't seem to bounce back up all the way to where their old baseline was. They then plateau again for a while, and then something else happens, and then boom, they step down the step again, and they seem worse than their previous baseline. By the end of that staircase, when a person with dementia is at the end of life, typically the person will need assistance with everything, all daily activities: bathing, dressing, getting out of bed, toileting themselves, feeding themselves. They become incontinent of both their urine and their bowel movements. They speak only a few clear words a day, and if they speak more than a few words, it doesn't make sense, or it might even sound like gibberish. Many people stop speaking altogether in the end stages of dementia. Eventually, the person can't walk, they won't be able to sit up on their own, they can't smile, or even hold their head up. It is completely normal for the person with dementia to eventually stop eating and drinking. This is a natural part of the dying process as the body is shutting down and preparing for death. It's important to realize that the person isn't dying because they are starving or dehydrated. The person isn't eating or drinking because they are dying. And it's also really important not to force a person to eat or drink when they are at the end of their life, because this can lead to more complications and other forms of distress. If your person with dementia is starting to pocket their food, so food is collecting in their mouth, they're not swallowing everything, or they are throwing up after they eat, or they're coughing during or after they eat, this is usually a sign that my patient with dementia is probably close to death, oftentimes within days to weeks. A few other signs that a person with dementia is approaching death are other natural signs of the dying process. They're sleeping all the time, or they appear to be completely unresponsive and unconscious. Their eyes might be slightly open, but they're not making any eye contact. Their eyes are in this fixed position. Their jaw might be relaxed and their mouth might be open. Their breathing changes. You might notice these heavier and faster breaths with periods of no breathing at all. This is called Cheyne-Stokes breathing and is again a normal part of the dying process. You might even hear a gurgling or rattling noise with each breath that they take. This is called terminal secretions, or you might also hear it called the death rattle. All of these changes are normal signs of the dying process and are to be expected. Whenever I'm working with families who have a loved one with dementia, I always encourage them to consider hospice earlier rather than later. It's never a bad idea to ask for a hospice evaluation, even if you're not sure the person with dementia is there yet. Hospitals are the worst places for a person with dementia for so many reasons. And so a big goal for most of my families is to keep their loved one out of the hospital and to really focus on comfort and quality of life rather than quantity or length of life. Hospice can provide that extra layer of support both for the person with dementia and for their family. Because hospice has a team mentality with a philosophy that embodies comfort and quality of life, they can support families through the end stages of their loved one's dementia and prepare them for their person's death. Home hospice will actually come out to your home so you don't have to bring your person with dementia anywhere outside of the home. Hospice provides a home health aide to assist with daily care, a hospice nurse to check on the person's comfort and their health, a social worker to help families in finding additional resources and providing emotional support, and even a spiritual counselor, a bereavement counselor, and volunteers as well. Some hospices are even adding end-of-life doulas or death doulas to their service as an additional layer of support. For a person with dementia, even in the end stages, it is hard to know for sure what their life expectancy will be. Generally speaking, once on hospice, the person's life expectancy is estimated at about 6 months or less. However, some people with dementia will stay on hospice services for a few years before they die, and some a few weeks before they die. As long as the person with dementia is continuing to show signs of decline in some way, they should be able to stay on hospice services. And that's a big reason why I encourage families to have hospice on board early, because the hospice nurse will continue to come out and evaluate the person with dementia, and they will be able to give you and the family a better indication of time frame and life expectancy as they're noticing even the smallest changes in the person with dementia. Again, for me, when I see a person with dementia suddenly stop eating, or they're pocketing their food, or they're throwing up after they eat, or they're suddenly sleeping all the time and they have no interest in getting out of bed or getting up, or they are showing some other functional decline in their normal day-to-day, this is a big cue for me that they are probably within days to weeks of death. I hope this information has helped you understand or prepare a little more for what to expect when a person with dementia is at the end of life. Thank you so much for watching. If you have any questions, don't hesitate to leave a comment below. I will do my best to answer your questions in other videos. And if you'd like to hear more from me, please consider liking and subscribing to my channel. I share more about death and dying and end-of-life care and hospice and end-of-life doulas, grief, and so much more. Thanks so much, and I'll see you next time.